Welcome to this session, an introduction to using guided imagery in sports recovery. I'll be looking at guided imagery in general, introducing it, defining it, explaining it, and we will look at the research and the evidence to support the use of guided imagery. I will occasionally give you some of the research specific to sports rehab and rehabilitation and recovery, and I'll put it in the context of a psychoneuroimmunological framework. We looked at session 1 briefly at PNI. I would like to highlight that this really is a brief introduction. In this session, I'll introduce you to using guided imagery for personal practice. It takes a lot more than this brief introduction to understand the requirements to apply guided imagery clinically for therapeutic benefits or specifically for sports recovery. But it certainly is a very good introduction to the benefits of using GI, guided imagery, and how it can be used in sports recovery. To begin with, because as I did in session 1 with diaphragmatic breathing, I will take you through an exercise, not immediately, but while you're sitting there, please think of a place of your favorite, calm, comfortable, happy, and safe place, your go-to relaxing place. Now, this place can be real or it can be imagined. So for me, lying on some soft cumulus clouds in gentle sunshine is a relaxing place to imagine. So your place can be real or imagined. You've got plenty of time in the back of your mind. Please think of a place and have it ready for the exercise that we will do soon. So before we get to guided imagery, in English there are numerous words used for imagery. We've got visualization, we have mental imagery, and then it becomes specific. So imagery rescripting is a very specific way of using imagination to change the impact of a negative event. Guided imagery means that either a live person or a recording of a person or an app is guiding the person through the exercise. And so you could have guided mental imagery, guided visualization, guided imagery. Of course, there are many definitions and ways of explaining imagery and guided imagery. It is the internal experience of a perception of an event that is perceived without anything there, without any external stimuli. So being able to imagine a red rose even though there's no red rose in front of me. It's the internal experience, and even smelling it. The internal experience of perception without an external stimulus. You can use imagery, visualization. You can use any of the 5 senses in this way. Imagery is using the sense of sight. You can imagine that you are smelling a red rose. You can imagine that you are comfortable and warm and content. So all of the 5 senses can be used, the same as visualization, the same as imagery. This I talk about more in longer courses, and this goes a little bit beyond the scope of an introduction. But what we are doing when applying guided imagery clinically, therapeutically, is to think of a specific goal, a specific outcome, to improve performance in the case of sports, to enhance healing and recovery, for conflict resolution, for pain, for anxiety. So guided imagery visualization is better when it's more specific, and it's a coping skill. It's a practical skill that we offer people to cope better with life's challenges and sports challenges. Now, this is probably the most, if you take home one thing in this session, physiologically, perceiving the real thing compared to perceiving the imagined thing, physiologically, there's almost no difference. It's very, very similar as to what happens in our physiological, biological processes. And a good example of that is if you have a phobia, you don't like spiders, if you were to picture and perhaps even feel a spider, you would get the same pilomotor reflex, the hair up on your back. You would increase the heart rate, respiration rate, blood pressure would increase. So those same sympathetic nervous responses are elicited with the imagined, perceived thing, almost the same as if it's actually in front of us, as if that spider is crawling on my leg. I'm Australian, I don't have a arachnophobia. So this is really the bottom line. There are many, many mechanisms by which guided imagery works, but the bottom line is that the physiological processes that operate in imagery are almost the same as if we are really perceiving the event or the object. And that all those physiological processes happen almost immediately. It requires focus, and that's the main reason why people like guided imagery compared to imagining something themselves. Whether it's an app or someone like me guiding them through, it encourages that focus, stay with it, continue to see, hear, feel. When we use guided imagery for therapeutic outcomes, it's important to keep it realistic. So we have to imagine something that can possibly happen. You know, I can imagine that I'll win an Olympic medal in the 100-meter sprint. I can imagine that till the cows come home. It is highly unlikely that it will ever happen. Guided imagery is certainly safe, and these techniques that fall under relaxation therapies, like diaphragmatic breathing as well, none of the literature, none of the research shows any direct detrimental effects. It is safe, and there are virtually no side effects. There are certain things to consider when applying guided imagery clinically, but no direct side effects. And clinicians have used guided imagery with young children, with teens, in adulthood, in aged care, and in sports. To go back to the physiological processes, we know for a fact that guided imagery, by imagining something consistently and specifically and positively, there are, well, therapeutic benefits neurologically, endocrinologically, and with immune responses. So in session 1, I introduced psychoneuroimmunology, which is the study of these 3 body systems and how they interact with each other, how they communicate, how they influence each other, and how they tell each other what to do to ensure that the necessary physiological processes are conducted, are happening. So there are effects from guided imagery on all three of these body systems. Let's go through some of the very interesting and high quality randomized controlled trial studies and research that provides the evidence for the benefits of guided imagery. This is already 12 years old, this study, published in Neuroimage, in the Journal of Neuroimaging. Well, I think it's called Journal Neuroimage. You have the link there. You can look at the article in detail. This study looked at two groups of people under 4 different conditions: healthy people and people who had had a stroke. So the two groups each underwent passive movements. So passive movements is when someone else takes one of your joints through the range of motion. Okay, that's a passive movement. 4 conditions for both groups. They involved wrist movement. One of the conditions was passive movements, when somebody else rotates your joint. I do believe that passive movements are a very undervalued intervention, in terms of body work, in terms of healing. So passive movements was one of the conditions. Active movements, so rotating the wrist myself or each subject in each of the 2 groups, healthy and had strokes, did their own active wrist movement. They watched as somebody else moved their wrists, their own wrists. They watched someone else move their wrists, and then they imagined movement of their own wrist. So 4 conditions: passive, active, imagined, and observed. There were a lot more results in this study. That's why I give you the link. But what they found that in the stroke group, in the group that had of people who had had a stroke, and they did this with electrodes. They found that the cortical activation, so the cerebral cortex, the activation, the firing of those neurons in the cerebral cortex were activated the most similar to active movement, to doing the wrist movements, as it is imagined. So the same sort of neurological firing is occurring when imagined compared to when it's actually done, and particularly in the people who had had strokes. This is a very significant study. There have been other studies done, many other studies, and we can look at this later as well. This study in 2019 in Central Nervous System Spectrums was a review article. So it looked at a whole lot of other studies, and they looked at mental imagery in psychiatry. They looked at the clinical implications of mental imagery for psychiatric conditions. And for me, this is particularly significant because 25 years ago, psychiatry would never entertain anything like this. So to be published now, I have many articles that are published in psychiatry journals, and this is looking particularly at a psychological intervention, because that's what mental imagery is, at a relaxation therapy technique, because that's what mental imagery is, and using it for psychiatric conditions. It is a review, so they use the term mental imagery, And this review discussed the neurocognitive influences and basis of mental imagery. They discuss the links between emotion, motivation, very important in sports and sports recovery, and linking emotion and motivation with mental imagery. They also then took the neuroscience and the link with mental imagery and emotional states and things like motivation, and they looked at it in terms of psychopathology. And they've called, and in 2019, it's not novel. It's been used for decades and millennium. But, you know, this is a novel innovation, and it is a very real treatment, intervention, therapy with positive outcomes for specific conditions. I want to mention this very briefly. You can look it up. Elon Musk, now I'm not comparing him to randomized controlled trials and peer-reviewed studies, but it's worth mentioning that he has a system, a business called Neuralink, and they worked on it. They applied the computer chip. So this goes beyond electrodes, a chip in the skull and electrodes for the brain. And this is the name of the man. And I can't remember, he's a paraplegic or quadriplegic, or I'm not sure what his condition is. I can't remember. But obviously can't move. And he could look at the cursor on a screen and imagined its path to where he wanted it to go. And he called this imagined movement. And he, with the chip and with the electrodes, he was able to do that. Now, the implications of all this, irrespective of how many ethical reviews saw this before it was done, I don't know. The implications of these are really important for people who are hospitalized, immobilized, who have a cast on, for that lack of mobility. What it means is that if we imagine ourselves moving, then the physiological processes can be operating as if we were moving. And I won't discuss that any further, but that has enormous implications. Here's a summary of looking at imagery in sports rehab. You and all your colleagues and peers, as well as the athletes, have been using mental imagery and guided visualization, guided imagery in sports performance for many, many years. I know that guided imagery has been used in pain management for decades and well before this really sophisticated research. They knew clinically that it worked. It seems as if from this study that elite athletes use imagery a lot more than Saturday footballers or novices or less successful sports people. So that's encouraging. We just have to get the lower level sports people to use it as well. It's been guided imagery and mental imagery, call it what you will, has been used in team sports, individual sports, open and closed sports, fine and gross physical skills. In gymnastics, dance, figure and synchronized skating, in hockey, rugby, and in the martial arts, imagery is used extensively. There's almost a common sense about it, that if you want to achieve a great sporting event or your personal best, you see it, okay? But it is used and it is studied. This study demonstrated that it seems to be largely underutilized and could be used a lot more. we need more research to look at how imagery works in a particular rehab setting, and particularly for sports rehabilitation. But I think that we're understanding more and more. And I also believe that there is enough research to support its use. An interesting comment from one of the articles was that perhaps an athlete doesn't use guided imagery because in injury rehabilitation, because they simply haven't been taught how to transfer that skill from performance imagery to rehab imagery. And that's why we need education in this area. That's why there are more than brief introductions to using guided imagery clinically. Okay, so it is used for all of these things. And it was only putting this presentation together that I came across this journal. So this is very exciting. And if, again, if there's only one thing that you take away from this presentation, perhaps it's that there is this particular journal of imagery, research into imagery for sports and physical activity. So I've given you, it's actually one of the volumes, but you can go to the link and have a look. So after this brief introduction, you'll be able to look at the research. Okay, so that, you know, is a drop in the ocean. It's the tip of the iceberg. It is a brief introduction to what is guided imagery and how can it be used to our advantage. I also said that I would put it in a context, in a framework of psychoneuroimmunology. So given that PNI examines the nervous, endocrine, and immune systems and their impact on each other, it's important when looking at a PNI framework of rehab that we have a clear understanding of what is inflammation, what is acute inflammation, what is chronic inflammation, and how do they affect us. So inflammation is one of the major primary jobs of the immune system. The immune system is designed to protect us from injury and infection. That's one brief definition: injury and infection protection. And the immune system does this through the inflammatory process so that our tissues heal, regenerate, and improve. As you know, the inflammatory process is represented by heat, edema or swelling, pain, and redness. Now, that's if it's superficial and if it's visible, but the same happens internally with internal injuries. The brief, the job of the inflammatory process is to repair the infection or the injury as quickly as possible. Rapid healing. Now, obviously, the duration will differ for a paper cut compared to 3 broken bones. But given the extent of the injury or infection, the job needs to be done hard and fast. So the inflammatory process as a biological, physiological process is designed. It's meant to operate for a few hours, a few days, push it out to a few weeks, but not months, not years, not decades. And people have low-grade chronic inflammation for months, years, and decades. So here's excuse me, the inflammatory response, very, again, simplistically. There is a good YouTube clip to watch there. It's a good one. And I've been putting this into my presentation since before COVID, but this one was put out by, oh, now it escapes me, one of the vaccination groups. You'll see it when you watch it. So I'm going to mention this again later. But this is the inflammatory response, which is the major job of the immune system. As we step on a nail or get a splinter, a cascade of cellular and molecular changes occur as part of the inflammatory response to help heal and clean up ASAP as soon as possible. Then that's what acute inflammation is. It's the normal inflammatory response that involves the upregulation. This is the upregulation of phagocytes and other cells that initiate the inflammatory activity to eliminate and resolve, that's the best word, resolve the threat. Again, not meant to last for a long time. Most of the time there is a defined cause, a splinter, the coronavirus or flu virus, or a bacteria, or something that is not self, that the immune system recognizes. It's a definite thing. The immune response decreases as we get better, as its job is done. And in someone who is healthy, unless it's major infection or injury, to almost any extent, from a little bit to 100%, depending on the injury and the person, the effects of the injury or infection can be reversed, are reversed. Again, let's have a look. There's something important about this. The immune system is split into two main branches. Innate is what we're born with. So we are born with these natural killer cells, quite remarkable cells of the immune system. Neutrophils, all the others, we are born with them. They are innate. Well, here it says antigen or antigen, but when the inflammatory response, when the immune system needs to kick in, it, if necessary, can then employ more specific cells which belong to the adaptive or acquired immunity. And they're highly specialized cells with a specificity and a memory. So they're very specialized. The B cells produce antibodies. The T cells help kill. So they produce cytotoxic they kill other unwanted non-self pathogens, antigens. But what I want to highlight here is that this occurs over a matter of days, not months and not years. It's a short-term response. The research is very definite now about inflammation and its involvement in diseases and conditions, chronic conditions. The IR is the immune response. Okay, we know that the immune response, whether it's the immune response or inflammatory response, it's both. It's initiated when there is a threat or an injury, and it's quickly resolved. That's the aim of it. The inflammatory response becomes harmful to us, detrimental to us, when it continues without a resolution, when the job is not complete. Very importantly, the research over the last, well, many years, but what we've understood for the last 8 or 5 to 10 years is that there is a causal relationship between inflammation and disease, inflammation and chronic conditions. There is a causal and bidirectional relationship. So inflammation can and does cause disease. Diseases can and do cause inflammation. And the research now is beyond doubt. It is secure and strong that depression and inflammation go hand in hand. They're present with each other. And that is known and accepted. And then what happens, so depression, inflammation, depression, inflammation, depression, inflammation, after more than days, weeks, and possibly months, it becomes what some researchers have called a vicious cycle. And sometimes we could never determine which came first. Was the depression first or the chronic inflammation? Did the chronic inflammation come first and then the depression? After a while, it may be impossible to know unless there was a definite cause. What is important, and this is to prevent ongoing chronic injuries, is that we nip it in the bud, that we break that cycle somehow. It doesn't matter where in the cycle. The research and even the clinicians in the clinical practice now understand that chronic inflammation, chronic distress, chronic disease and conditions are all linked in a causal relationship that usually ends up in a vicious cycle. So that's a very important reality that guided imagery can change and interrupt that vicious cycle. So again, very briefly, guided imagery has been shown to reduce pain, anxiety, which are chronic conditions, the impact and effects of different diseases and surgery, mood disorders, anger, depression, sleep disorders like insomnia, restless leg syndrome, and also trauma such as PTSD, hyperanxiety, hypervigilance. Guided imagery can also enhance performance, and that's exam performance, sports performance, can enhance concentration, quality of life, QOL, how efficient we are, how well we can concentrate, how well cognitive processes, how well we can perhaps recall. Guided imagery is used a lot in conflict resolution. It's very specific how you go about it. Once you've learned, it's not difficult, it's a skill, but there are some very important principles to apply it. And then certainly guided imagery in healing and recovery of any kind, including sports. So in a nutshell, guided imagery as a relaxation therapy, as an intervention, is evidence-based, it's non-pharmacological, it's non-invasive, again, cost-effective. It's very simple once you know the details, and it is not difficult to teach someone how to do it once you know the basic important principles. So I'll continue for a little while. This session, as I said at the beginning, is aimed to give you more information about GI, but also to encourage you to practice for yourself, personal practice of guided imagery. I'm going to introduce you to guided imagery for relaxation, not for a specific condition or event or whatever. This is guided imagery to relax. Same list as I gave you last week, and this is important, that you set yourself up appropriately to do guided imagery, not to be interrupted, to be hydrated and warm enough. And to know that you're in control. So if you listen to an app and you don't like that particular app, find one. There are, the English technical term is gazillion. There are hundreds of thousands of apps now. And one of the early ones many, many years ago that I listened to was a New York accent. And I didn't find that relaxing at all. But I'm sure there are many people who wouldn't mind. So there's very much that individual, it has to appeal to you. You may not like the session with me, my voice, what I say, that's fine. The beauty of the technological age is that you can find an app that suits you. So you're always comfortable as possible, and you can control, you can move, scratch, itch, make yourself comfortable. And as I mentioned before, you can use this approach for any of our five senses. I will concentrate, I'm going to take you through and look at these two, seeing and feeling. I quite like this picture, except for the fact that his arms are behind his head, and that's not a good posture to be in, but can't have everything. All right, so if you want to stop the recording, get yourself organized, now is the time. I will take you through a guided imagery session for relaxation. So make yourselves pause for now, make yourselves comfortable, and I will begin. If you're seated, have your buttocks back in the chair, feet firmly planted on the floor or a book. Your shoulders are down. Warm enough, phones off. If you're lying down, then this is a good position to be in. So to begin with, closing your eyes if you are comfortable to do so, and eventually closing your eyes when you're comfortable, remembering that you can stop and start whenever it suits you. Begin simply by bringing your awareness to yourself. It might have been a busy day, and it's not often that someone allows you and encourages you to take time for yourself. See yourself, bring your awareness to yourself, and as all those other thoughts come to mind, allow them to drift away. Allow other thoughts to slip away. And see yourself, feel yourself on the chair or bed. Notice the weight of your body on the chair, your buttocks. And with your eyes closed, bring your awareness to your breath. Simply notice without changing anything where your breath starts, where your breath goes. Allow other thoughts to move away or melt away. Bring your awareness back to you and to your breath. And now calling upon the place that you have chosen as your favorite, calm, relaxed place. Very gently and always in your own time, bring your awareness to this place. Allow other thoughts to melt away and come back to your calm, happy place. With your eyes closed, see yourself here in this wonderful place. Look around and see that you are here. In your mind's eye, look around at the details. See what is here. Gently, in your own time, look at the colors around you. Notice the colors, details. Look closely and see colors, shapes, contours. See all that makes this place calm and comfortable. Look around, aware of what you can see. Look closer at the hues and depths of the colors, size and shapes. Look ahead and notice. Look around and notice all that you can see. Colors, shapes, shadows, contours and details. Look and see. Aware of all that you can see. Other thoughts drift away as you closely observe your calm, happy place. And in your own time, aware of yourself in this calm, peaceful place, slowly aware of what you hear. Listen to the sounds around you. What do you hear in your calm, relaxed place? Aware of the sounds, listening to the rates and rhythms, pitch, resonance of all that you hear in this Slowly be aware of the sounds around you. What do you hear? Enjoy the sounds. Aware of being in your favorite place. See yourself in this place. Aware of the sense of calm. Slowly in your own time, with your eyes closed, bring your awareness to yourself, to you. Notice your body. Notice yourself in your room now, still calm. Gently bringing yourself back. We have plenty of time. When you're ready, with your eyes closed, wiggle your toes. Do some gentle movement if you'd like to, with your eyes closed, slowly coming back. And when you're ready, rub your hands together. Place the palms of your hands over your eyes. And when you're ready, looking down, gently, slowly, in your own time, when you're ready, opening your eyes. And that was exactly 10 minutes. I take people through specific things for 30 minutes, even up to 45. But the effects are fairly immediate. Now, it is like any skill to sit through something like that. It takes practice. And if you don't particularly like that, my style, that's fine. Find something that suits you. You'll notice that I did all of these things to bring you back. That's very important. So never rush yourself. Keep your eyes closed while you're coming back to the real world. So the idea of guided imagery, guided visualization, guided mental imagery is that there is someone who keeps you focused and on track, because it is human nature, human biology, in part, for our thoughts to wander and meander and pop in and out. And it becomes easier, as all skills do, the more we practice. So I'd like to, again briefly, start to talk about guided imagery in a clinical therapeutic setting, but I would like to give the sort of the caveat, to emphasize that this is really just a brief introduction. I've said it a few times, so I'm sure you get the message. So looking at using this for specific conditions, again, a lot of research. In Australia, and I haven't looked in other countries in particular, but in Australia, the federal government, the national government, the Department of Health recognises guided imagery as a relaxation strategy and as a cognitive behavioral therapy and as part of psycho education and skills training And it is scheduled so that a psychologist can actually use these techniques and get a rebate, or that the patient can claim. Very specific conditions, very specific health professionals, but it is recognized. They're called focused psychological strategies, all of this. So there's no doubt that, this is efficacious. Guided imagery does fall under psychological interventions. Relaxation therapies are psychological interventions. They're also lifestyle medicine, but one of the aspects of lifestyle medicine. Everything depends on our perception, and psychological interventions can and do change our perception, particularly of stress and distress. Missing out on a game or a competition because of an injury is incredibly distressful. How can you reduce the impact of that distress, that disappointment, that frustration? Through diaphragmatic breathing and guided imagery. They are coping skills. In terms of psychology, it's a known principle that the greater control someone has over their life, over their health, the better our mental health. And we know that from everyday life. Sydney traffic at its worst, at a standstill, I have no control. I can't move an inch forward, backward, left, or right. It's beyond my control, and that increases frustration. So offering techniques like this to people offers them greater control, and that immediately improves mental health. We also know that all of this affects immune responses, neurological activity, and hormone responses and release. There are many apps. So if you're interested to learn more and practice more guided imagery, you can find them on your phone. Many of them, most of them are free. Try more than one and find one that suits you. There's one called Calm. There are many. I tend not to recommend any because it's such a personal choice. What I recommend to you after this session is that you practice guided imagery for yourself. Now you don't have to use an app. You can use that concept of taking yourself to your favorite place, sit quietly, find a private moment, and imagine, see, feel, hear yourself in this calm, relaxed, safe, happy place. Practice for yourself. And that's how a good practitioner, that's what a good practitioner has to do before recommending and using it clinically. I've gone through all of this. So that is an introduction to guided imagery. I have introduced you to the idea that when we use these techniques like diaphragmatic breathing and guided imagery, they have a direct and indirect impact on our metabolism, on our cognition, on our psychological factors, on our ability to fight disease and infection, and on our ability to heal. Nothing operates in isolation, and we know that for a fact. So thank you very much for your attention and your interest, and you can contact me via these links. Good luck with your use in guided imagery.